Good morning, good afternoon, good evening, everyone. Thank you very much for coming to this important webinar. Um, and welcome to the LCI community. We are raising lifestyle champions here. Lifestyle champions will make healthy choices every day, not just the one choice, but the ones that you can sustain and you can keep doing over and over. And today we have this special webinar as a commemoration of the World Sleep Day, which holds annually in March. Anyone here who's heard about the World Sleep Day? Okay, well, you're here now, and that's what we are celebrating. And do we know why sleep is important? We know how important sleep is to us, to our lifestyle, to our well-being. And well, I'm not going to be talking to myself tonight, please. Okay, and maybe before I go on, let me just quickly introduce myself. My name is Dr. Jaye Olaleye, and I am a GP. I'm a lifestyle practitioner. I have special interest in women's health, and I'm going to be moderating the session tonight. So please, I'm not talking to myself. I would like you to contribute. And as you're joining, if you can, I would like you to introduce yourself if you feel comfortable to do that. And if you can drop where you're joining from, that would be really, really lovely. And let us know if this is the first time you're joining us. That would be good to kind of have a feel because we've had a few webinars. I've come for some myself. So if you're joining us for the first time, just also let us know if you're joining us for this first time as well. So like I was saying, sleep is one of the most powerful but often neglected pillars of our health. So we're going to be exploring how it affects our well-being, and we're going to be hearing some real life testimonies as well from people who have struggled with sleep problems and learn practical strategies on how we can all improve our sleep. One of the very important things we'll be doing tonight as well is that we're going to be conducting a very short survey, and also we'll be sharing some bonuses. So you have to wait till the end to get all these bonuses, okay? So first of all, if I may, Dr. Makinde, with the survey, is somebody going to be putting it in the chat box? How is it going to work?
Yes, yes.
So we're going to be sharing a short sleep survey in the chat in a short moment. It's going to take us about 2 to 3 minutes to complete. And this is really important because your responses will give us an idea of what are the commonest sleep challenges and help us to guide our future programs. So we're going to be dropping the link in the chat in a moment. Please look out for that. But may I just welcome a couple of people who have been joining us. I'm going to call names. Thank you, Dr. Taiwo Makinde. Thank you, Abiodun. Thank you, Ade. Thank you, Afolabi. Thank you, I'm Favored Friday. Ade, the names are just jumping up. Thank you, everyone. I see you, Dr. Aladewolu. Thank you so much, sir. Dotun Dunton, Dukwe, Eunice, Gold, Oluyemisi, Ngozi, Nina. Thank you all very much for joining. Is the link in the chat now?
Okay, give me a minute, please.
Okay. So we are going to be putting a link in the chat. We would like you to complete that survey for us. Thank you, Mrs. Oyego K. Thank you, Dr. Akindole, for joining us as well. We appreciate your presence here tonight. So once we've dropped the link, the first thing we will be doing is someone is going to be talking about their experiences, first of all, with their sleep problem. And we'll be introducing that speaker shortly. But we're just waiting for the link, which will be coming on very shortly. There we are. I can see two links there. Thank you very much for putting the link there. Amazing. It's going to take us about 3 to 4 minutes to complete. So why don't we quickly do that now before we carry on? It's got how many questions? Oh, wow. It's got a few questions. It's got 17 questions. So I would like us to do that. Is that correct, Dr. Makinde?
Yes, they're very easy to answer
They're
questions,
very
actually.
easy to answer questions. Oh, I'm so sorry. The network is not favorable, Mr. Igoke. I'm so sorry about that. Perhaps you can log off and log back in and see if that works better. Okay. So I'm going to be just quietly here watching the charts. So please take a few moments to fill that survey for us. Thank you very much for as many of you that are starting to do it. So how many of us are doing it? Just raise your hands in the chat. Let me make sure because I don't want to be. That's good. Thank you very much, Mrs. Colade. Anybody else who is doing it, just raise your hand in the chat. So in your, otherwise I'll start calling names. Please put your hand up in the chat if you're actually filling the survey. Thank you, Suzanne. Thank you. Thank you very much. Anybody else? Thank you very much, Adidotun Ajelabi. Thank you so much for filling the survey. Much appreciated. I need a few more hands, please. Eunice, thank you. And I think there's another hand raised there. I can't quite catch it. Thank you. The link is there. Eunice, Adidotun. Thank you very much. Teresa, Nena, thank you very much. I see your hands. Thank you very much. I'm just going to give maybe 2 more minutes so that we don't miss out um the juicy bits. Thank you very much, Mr. Gbadebo. Thank you very much. Thank you. Thank you, everyone that is making the efforts. Oh, sorry, Mr. Olayiwola. Yes, the link has been sent. Thank you very much, Gold, your golden star. I'm going to give you 5 golden stars for your activity today. Thank you. All right. Thank you so much, Ari. I really appreciate the effort you're making to do the survey. All right. So whilst everybody else is doing that, may I pass it over to Dr. Makinde to introduce, first of all, um the um the testimonial section. We have 1 or 2 people who will be telling us a bit more about their sleep challenges. Is that correct?
Yeah, absolutely correct. So I would like to say good afternoon, good morning, good evening, depending on where you're joining us from. I'm so excited tonight. Um, First of all, because it's World Sleep Day, and then secondly, because it's our first LCI webinar for the year. You know, we usually love to have this at least once in a quarter. And so I'm getting to see all our beautiful faces, and I really want to thank you for following us in the past few years. I was just looking back and I discovered that we actually started this journey in the year 2020. Isn't that amazing? And this is 6 years down the line, and see how far God has brought us. I'm so grateful to every one of us who has been a pillar of support and encouragement. Thank you, Jaye, for doing this. Jaye is one of the associates of LCI, and they're the ones that support me, you know, whenever we have outings like this. And so, in the course of trying to raise awareness about healthy sleep and encourage people who have sleep difficulties. Some people actually got their sleep back. They got their sleep regime restored. And so we have two of them on the call tonight, and they have graciously accepted, to share their story with us. So in about 5 minutes each, or be three, every 5 minutes, they will be telling us what it was like for them. So the very first person I have here is Mr. Biodun Gbadebo. Are you here, sir? And then the second person is Mr. Friday Aideno. So both male. Maybe we'll have a lady who will want to volunteer after they have given their own brief. So please, over to you, sir, Mr. Gbadebo.
Yeah. Yeah, good evening, doctor.
Good evening, sir.
Happy sleep. Happy what sleep day, or whatever you call it. So number one, I want to thank Dr. Makinde for the good work you are doing. It's my prayer that God will reward your efforts.
Amen.
In Jesus' name. So there was a time I had problem with sleep. I am an hypertensive patient. I had problem with sleep. That time, I was unable to sleep for more than 2 hours. So there was most time I took a lot of sleeping pills. I know their names, even apart from knowing their names, I even know their generic name. So I got used to the extent that I will go to the internet, go to Google to ask to buy drugs from there. So when I told Dr. Makinde, he gave me some practical steps on what to do, on how to stop, on what to do, how to overcome it, by changing my lifestyle. Number one, he told me how to concerning my diet. That I need to change my diet to minimize, if possible, run away from anything caffeine drinks or carbonated drinks, which I did that time. He also told me on how to include what do you call it, a practical exercise, which I did this morning up to today. Even today, as of today, I walked 3 kilometers today. Because of that one, I bought a watch that helped me to monitor my exercise early in the morning. So it has really been effort for me to do that every time. So
we lost you, sir. Your voice has gone far.
Okay. Can you hear me, ma?
Yes, sir.
So I took some practical steps. Changing my diet, about my following my own exercise, just brisk walk that I've been doing. So like what I said before, I said up to every day, I try to make sure that I have a walk up to 160 to 180 per minute every week. 160 to 180 minutes every week. So up to this morning, I still trek for almost 3 kilometers today. So it has been a very routine exercise for me to do every morning before I go to office. Even if I cannot make it at times, I'm just on weekend, I cover the lost ground. So by God's grace, I sleep up to as a minimum of 7 to 8 hours. But at times I sleep up to 10 hours if there's chance for me. In the afternoon, at times I sleep on my sofa. So it has been very, very, very wonderful. So I can tell you boldly that I don't have problem with sleep. Even at times I used to consider that am I not sleeping too much? but I know that I'll be very sleeping effortlessly. Even if I'm using my phone, even if there's TV, love, that one will not disturb me from sleeping. I sleep without any. That's why, because of the lifestyle. Despite the fact that before, while I was using drugs, using all those things, even my PP drugs that I used to use 10 milligram every day, so I've reduced it to 5 milligram. But even with that 5 milligram, at times I skip it. But I used to make sure that I use my BP machine to ensure that I'm still on track. So I want to thank God. I want to thank Dr. Makinde uh, for for guiding me, for counseling me, and also thank God for making me to follow the counseling. So that's my little testimony.
Wow, wow, wow. That's amazing. Thank you
Yes,
so much for sharing that with us. We are so very, very happy that you got your sleep regime restored just by making those
yes,
lifestyle changes. A lot of people have
yes,
discovered that when they start taking pills, is either they are not sleeping well or their sleep even worsens. A patient still told me that today that it was as if everything became worse, after she started taking sleeping pills. So I'm glad that you could share that story because it will inspire some of us here tonight to also make some lifestyle changes. Thank you, sir. So let
thank you
me
so much, ma.
invite, yes, sir. Let me invite our second testifier. Hello, sir. Miss Friday. Can you unmute yourself and speak, sir? Is it there? Are you on the call? Let me see.
Good evening. Can you hear me?
Oh, yes, sir, we can.
That's
Over
nice.
to you, sir. You're welcome, sir.
Thank you, madam. Good evening to you, everybody in the house. My name is Friday Amerio. I had this challenge of inability to sleep, and that's some years ago. And I went to a private clinic. I was treated for malaria and all that, thinking that could be the cause. But that didn't solve it. So I had to come to Lagos State University Teaching Hospital. They also treated me, but at the end of the day, the doctor that I used to meet now recommended I should join a lifestyle clinic. So that was how I came in. So when I came in, I met some other doctors in the team. Then I later met Dr. Makinde. So all they told me to do, one, exercise.
Okay.
So, and of course, nuts. Hello, can you hear me?
Yes, sir, we can hear you. We lost you before, but we can hear you now.
Hello, can you hear me?
Yes, sir, we can hear you.
Can you hear me?
Yes, we can. We can.
Okay, okay. So I did all of that. Then an issue.
Yeah, we are just following him. He has been walking by himself.
Hello, sir. Hello, sir.
Okay.
Going through what you've done for the app, and I did them. I think within
Oh,
2 or 3 weeks,
later now, call.
I overcame the challenge.
Oh,
So up to this very moment, as I speak with you, oh my God.
That's amazing. Thank you so much, sir, for sharing that with us. Your network seems to be going in and out, but we got the message that you had him is sleeping for some I can't remember how many months you said, or how many weeks, or how many years, but the message was that he had gone to several hospitals before we encountered him in the lifestyle medicine clinic, and we shared with him some of the lifestyle medicine strategies to help him to sleep better. And now he's able to sleep. Within 3 weeks, he was able to sleep. Thank you so much, sir, for sharing that wonderful, inspiring testimonial with us. I can see that Mrs. Inena's hand is raised. Do you want to share something about sleep as well? Do you want to share your story? Mrs. Inena, your hand is raised.
Yes, I want to say something.
Okay, ma.
Are you hearing me?
Yes, ma, we're hearing you.
Okay. Good evening.
Welcome, ma.
Agwu Nenna. The day I came to the hospital, the very first day I came, the time I was coming, I prayed to God to lead me to a good doctor that will see me. And on getting there, the first day, they took my folder to Dr. Makinde. And immediately she saw me, she smiled and told me, don't worry, that I'll be okay. And she took very care of me. Since then, I always talk about her. She's not hungry, she's not this type. So I've been following her advice, exercise, taking fruits, vegetables, because before I cannot sleep and I didn't know what was worrying me. I cannot sleep. So immediately I explained everything to her. She gave me advice, not drugs, so advice on what to be eating, exercise, like early morning sun, and bed. And I used to off my television. All the advice she gave me, I was following it gradually. So before I know it, I started sleeping well. I started sleeping well. That is why I always call her my doctor, because she did it for me. Before I cannot sleep, I will stay 2 hours. That is the highest sleep I can sleep, 2 hours. But now I can sleep very well. I thank you, doctor.
Wow. Thank you, ma. This is such an amazing testimonial, very encouraging and heartwarming. Thank you so much, ma, for sharing your story with us. We are very, very grateful. We're grateful. So I'm going to hand back now to Dr. Jai to continue with the program for today. Thank you so much to the three of you for sharing your stories. It's really, really heartwarming. Thank you so much.
First of all, I just want to say thank you again to everyone who shared their stories. I personally find it encouraging, and I'm really grateful for your words. And to me, it says one thing: it actually works. If you put in the effort, it does make a difference. Every single change you make to your habits eventually all adds up to help you feel better. Perhaps one of the things, maybe one of our testifiers, so to speak, haven't actually said, apart from sleeping well, I'm sure if we gave them enough time, they would tell us other things that have happened well. It may be that their joints are less achy, their muscles are feeling more relaxed, they feel able to do things even in a better way. They are able to think clearly, brain fog is clearing. And all of this is because they are sleeping well. Their immune system is working better because they don't have infections all the time. So all of these are the impact of sleeping well. When we sleep well, then a lot of things happen the next day. Now, are you ready for the next segment? So are you ready for the next segment? Now, this is the a very important segment where we will be learning. So we've heard about the experiences of people. Now we're going to come to the learning segment. And we were privileged from the founder of Lifestyle Champions International. And she's also our host for tonight. A lot of you already know our president, and she'll be speaking on the theme of this webinar, which is also the World Sleep Day, and she'll be sharing practical strategies. You know, all of the strategies you heard the testifiers talk about. She's going to be breaking it down so that by the end of this talk, you should be able to pick at least one thing. I'm asking you to find your pen and paper because I'll be asking you one thing you can do to make a difference to your sleep starting from tonight. Okay. So I would like again pass the mic back to Dr. Makinde. Thank you very much.
Thank you so much, Jai, and thank you so much. There is really full tonight. And in the next few minutes, I'm going to be sharing with us on this topic. So let me share my screen. Okay. Can you see my screen now?
It's not showing yet. It just says started screen. Okay, we can see it now. Yes.
We can see now.
Okay. All right.
Just presentation mode.
Full screen. Okay. Yes, I think I have to go backwards.
Yes, we can see the full screen now.
Oh, yes. So welcome, everyone. This is Lifestyle Champions International, and here we are passionate about raising a community of individuals who are also passionate about making healthy lifestyle choices every day. And one of those lifestyle choices has to do with our sleep, choosing sleep. There was a time I used to boast about not sleeping. You know, I would stay awake most of the night trying to write a case report, work on my dissertation, do one thing or the other. And then I'll still go to church the next morning and not doze. And then I'll make fun of people who are dozing in church, even if they slept all night. But you know, I had to change my perception at some point. And I think that's the first thing that each and every one of us need to do. We need to change our perception about sleep. So we're marking the World Sleep Day. And I had the opportunity of discussing with a news agent. She put out, you know, some information about sleep, you know, in some newspapers. I shared that on one of our consultants' page, and somebody said, in this Lagos, sleep 7 to 9 hours. So that's the first perception that many of us have about sleep. We don't have time. But the important thing is to change our perception and to prioritize sleep. So sleep well, live better. Unlocking the power of healthy sleep is what we're talking about. And that's the slogan, you know, for World Sleep Day 2026. If we sleep well, we'll live better. And there's a lot of evidence-based information that helps us to know that this is really true. So just to remind us of who we are at Lifestyle Champions International, our vision is to build a world of champions who win by preventing and overcoming lifestyle-related illnesses. Our mission is to promote general wellness and health-related quality of life among individuals, particularly women, by educating them and encouraging them in the adoption of healthy lifestyle choices. Our motto is live to win, choose life. Okay, so by way of introduction, sleep is a natural cyclical period of rest, which is common to both mammals I'm sure many of us have seen our pets sleeping and what they look like when they're sleeping. So, calm, without a care in the world. Do you sleep without a care in the world, or do you go to bed stressed, angry, exhausted? So the perception of sleep keeps evolving from person to person and place to place. But the question I will ask you, and I want you to drop that in the chat box. The question is, how important is sleep to you? Is it not important? I remember someone telling me that sleep is wasted time. It's a waste of my time. Somebody else said, oh, if you sleep 8 hours in a day, it means you're sleeping away 1/3 of your life. So we hear a lot of comments, about sleep. On the other hand, when some people are trying not to sleep, some people find themselves sleeping when they are not supposed to sleep. So they're on duty, and these are interesting scenarios where we find people sleeping. Have you ever found yourself sleeping in a service, in a boardroom? I remember doing some calls, and during one of the calls, I was actually dozing when speaking to a patient. So what would happen, if I was writing a prescription for that patient? Won't that patient be at risk? So a lot happens when we don't sleep when we're supposed to, and we end up, making errors that can affect other people around us. So most of the time, people limit their sleep duration consciously and intentionally because of night shifts, night vigils, reading, research. People just walk around the clock. And like I said, some people equate it, to strength, courage, or productivity. We have some statistics from the World Sleep Society, which say that 42 million adults are predicted to have chronic insomnia worldwide. And we have huge amounts of money, dollars that are lost in annual GDP globally due to reduced productivity associated with chronic insomnia. So because you're not sleeping, you might be absent from work for some reason, or even if you're at work, you're present, but you're not functioning optimally. And so 239.5 billion is also lost in hidden intangible costs annually, aside from the 417 billion lost in annual GDP. I'm sure the money is more now. Then over 16% of individuals over Africa and Asia have reported extreme and severe sleep problems, which were strongly linked to poorer general well-being and quality of life, as well as psychiatric factors. So let's look at the value of the free essentials. There are some things that are very essential for our life. So compare oxygen, to sleep, or the air that you breathe, compare it to sleep. These are freebies, and I'm sure many of us like freebies. So can anyone tell me what freebies you have received this year? I'm not talking about the air that you breathe in without sending any payments, to God, our Father in heaven, to say, Lord, I'm paying for this air you are giving me to breathe in. Is there any freebie you have received, without paying a dime? You just get that freebie. Would you consider sleep a freebie? Why? You could tell me, you could put that in the chat box as well. But when we are unable to breathe in by ourselves, then we have to take in oxygen. We have to get oxygen, that is put inside a cylinder, and that can cost up to $1,500 a day. And in the same vein, if you are not able to sleep, if you are deprived of sleep, then it's going to take a toll on your health, and you are going to also have low productivity. So the hidden costs of poor sleep include fatigue, poor productivity, poor concentration, memory, mood disorders, increased risk of accidents, and also your immunity would be weakened. You won't be able to fight infections. And so some people will just find themselves getting more prone to respiratory tract infections, skin infections, malaria. You keep going in and out of hospital. And it's just because they are not having adequate sleep. And what are the long-term risks? Hypertension, diabetes, obesity, cardiovascular diseases. So these are the conditions that have been associated with sleep deprivation. And these are not the only conditions, but I just mentioned these ones to highlight them. So this is blocking my screen. So what are the common causes? The common causes of poor sleep. The common causes of poor sleep include stress and anxiety, irregular sleep schedules, excessive exposure to screens, especially before bedtime, late meals, intake of stimulants like caffeine, in noisy environments, an inconducive sleep environment, medical conditions, and there are several medical conditions. So it's important to treat the root cause, but it's important for us to note that many sleep problems are lifestyle related and reversible. So let's look at some of the sleep barriers. I try to group them into three. We have intentional, inadvertent, and then disorders. So like I mentioned, there's some disorders, some medical disorders that would prevent you from sleeping, and those disorders need to be managed in their own rights. And that includes anxiety disorders, depressive disorders, sleep disorders. I will show you a classification shortly of some sleep disorders. Menopause, someone was just telling me about her experience with menopause tonight. Allergies, pain disorders, or illness. So these are things that can lead to problems with sleep. And then we also have other things like night planning. Some of us don't realize that when you plan at night, you're going to bed, okay, maybe you're an entrepreneur or you have a shop or something, and you're trying to plan or calculate how much came in today, where are the missing figures. If you are doing that 30 minutes to bedtime, by the time you're lying down, those figures are still going to be racing in your head. Another thing is late meals. When you take late meals, that can lead to indigestion, that can lead to reflux, and that can interrupt your sleep. Sleeping in the evening too, evening naps, especially after the hours of 3 p.m., can push back your biological clock and make you not to be able to sleep at night when you want to. Certain medication like caffeine, alcohol, then difficult discussions. If you start engaging in difficult discussions, arguments at night, that could keep you awake. Of course, baby nursing, babysitting, that baby's keeping you awake. You don't have a choice at that time. Then we also have some other intentional things. We night shift workers are people at risk of sleep deprivation, browsing. You see people just picking up their phones and going through TikTok and going through several social media channels at night. Night vigils, night study, TV, movies. Some people watch movies late into the night, and then you go to your bed and you discover you're not falling asleep. Something has happened. That sleep hormone up there has been given a signal and it's been shut down. And so it's going to be difficult sleeping. Of course, traveling can be a sleep barrier because it will cause jet lag as they're moving across one border to the other. So I just wanted to share this as well with us. We have the International Classification of Sleep Disorders, and it's important for us to know that not just one thing will address all these disorders. We have to treat the root cause. So if you do the basic minimum that we'll be sharing here tonight, and you're still not sleeping, please make sure you see your physician, make sure you are properly evaluated to find out if you have a sleep disorder, a sleep-related movement disorder, a parasomnia. A parasomnia means something like sleepwalking, sleep talking. Some people even sleep eat. They would have done so many things and they won't remember that they did those things. And then, of course, people that have breathing disorders when they're sleeping, you see them gasping, as they're sleeping. Such people need to see their physician and be properly evaluated and treated. We also have people that oversleep. They have slept at night, but during the day, they find themselves still sleeping most of the day. And then we have circadian rhythm sleep-wake disorders, and that happens a lot in shift workers, people that have to work at night. So the interaction or the connection between day and night and between them being awake and being asleep has been lost. So they also need to be evaluated properly. But I want to point out to us that there is a particular syndrome that has been called the behaviorally induced insufficient sleep syndrome, in which individuals, about 20% of the general population, they restrict their sleep time voluntarily, because they want to optimize, they want to perform, they want to make a presentation. One of my colleagues was still saying that how do you meet up, that she doesn't do more than 4 or 5 hours because she has a lot to do. So such people, once the week is past, at the weekend, they will say, oh, let me make up for the lost hours. But can we really make up if we do this week in, week out, and we sleep at the weekend? That doesn't really cover us. We'll still be at risk. And the people who are usually involved in this are the younger age group, people who abuse alcohol, people who work longer hours, above 40 hours in a week, and people who are either stressed or depressed. So what's the importance of sleep? Sleep is a healer. When we sleep, our body repairs itself. We get our energy restored, our immunity is strengthened. Sleep is connected with at least 700 genes in the body. So when we sleep, our body will regulate all the metabolic processes. It supports our emotional balance, it consolidates memory. It is when we sleep that short-term memory is consolidated into long-term memory. And this is very important for our students. So you can't read all night and expect to regurgitate everything in the exam hall. You have a brain block for sure. So that's just to summarize, the importance of sleep. Then it's important for us to treat the root cause. Sleep deprivation is a root cause of disease. And you can see this tree. I love this tree because it just gives you all that information about how stress, poor diet, lack of sleep, poor relationships, nutrient deficiencies, lack of exercise, toxic thoughts, trauma, it could be from childhood, with trauma childhood that has not been addressed properly, poor digestion. Of course, we have genetic issues as well. All these things, they can cause lifestyle-related diseases. And you can see that we have several of them: heart disease, cancers, depression, hormonal imbalance, overweight and obesity, autoimmune diseases, diabetes, allergies. And these are things we can combat by choosing to sleep. And of course, sleep is not the only thing, but sleep is also anchored around all the other pillars. So what happens when we don't sleep? It would surprise you to know that impairments due to sleep deprivation are similar to impairments due to alcohol intoxication. Are you shocked? So if you didn't sleep and you're driving, it means that you're drunk driving. So being awake for 17 hours is similar to having a blood alcohol concentration of 0.05%. And being awake for 24 hours is similar to having a blood alcohol concentration of 0.1%. Don't be a drunk driver. Poor sleep is also associated with increased levels of stress, anxiety, and negative emotions. So when people say, oh, did you wake up from the wrong side of the bed? They really mean it, even though they didn't know that there was scientific evidence, behind it. In the same vein, studies have shown that you have a lower resistance to the common cold if you don't sleep well. So shorter sleep duration in the weeks preceding to exposure to that virus. Maybe someone in your office started sneezing. So if in the previous 1 or 2 weeks you had not been sleeping well, you're more likely to catch that cold. And then it's important to note that adequate sleep protects the brain from Alzheimer's disease. And even if you don't want to get all the way to Alzheimer's disease, which is a neurocognitive problem in which people even lose their memory, they can't remember their loved ones in the latter stages, it's important for us to know that when we sleep well, even now, our brain will be cleansed of, different viruses and bacteria, and that would help to promote our memory and our concentration. So these are just to highlight why sleep is important. This was also a study. My daughter is working on rats right now. I saw the rats in in a box. And, they look like cute rats, but, we need those experimental rats, to carry out studies to see, what could be simulated, something that we cannot necessarily do in a human, but can be simulated in a rat model. So these experimental rat models, their sleep hormone was inhibited. The sleep hormone was inhibited by removing the pineal gland from their brain. So the pineal gland is the one that secretes the sleep hormone, which is known as melatonin. So after they removed the sleep hormone or the pineal gland, they discovered that their mammary glands, we normally call them mammary glands in rats, tumor growth was stimulated in the breast of the rats. And at the same time, too, when the rats were exposed to constant light, they also had stimulated tumor growth. And we also have studies that correlate sleep deprivation and several cancers like breast cancer and prostate cancer, and even some leukemias. So this is all to let us know the importance of sleep. And now for night shift workers, the World Health Organization has classified night shift work as a group 2A carcinogen. And as far back as 2007, the International Agency for Research on Cancer classified shift work that results in circadian disruption as being possibly carcinogenic. So you see, many of the things that we do, can predispose us to illness and disease. We need to make a choice. Sometimes we need to do these things, but for how long are you going to do it? And that's why we talk about a downshift. A downshift means you move from a work that is demanding, tedious, or taking a toll on you to something that is less, tedious or demanding, especially if it's going to take away your nights, from you. So there are some things that should not be done for life, in essence. All right. So it affects children as well. Sleep deprivation affects children. So this was a survey that was done among 915 infants less than 12 years of age. Sorry, 12 months of age. Infants are less than 12 months of age. And they followed them up till they were about toddlers, maybe 2 years. And they discovered that the infants that had a sleep duration of less than 12 hours during infancy appeared to become overweight and have more adipose tissue when they became preschool age children. So our children can also be affected. And if you notice, our children actually need more sleep than we do. So getting them up so very early in the morning and they've gone to bed late is not doing them a favor. So this is just to summarize some of the things that we've talked about, but I'll also point out here that immediate effect of sleep deprivation can include financial losses. There was a story of a woman who she was in the bank. She's a banker. I actually read it in Daily Bread, and she was to make a transaction and send money to a customer. As she was making the transfer, she dozed off, and she added about 6 more zeros to the equation, and she actually pressed the button, and the money, went into the other person's account. But thankfully they were able to get the money back. So there are some things that we can't get back just because we've made the wrong decision or we had wrong moral judgment. Then, of course, another important thing here is that when we don't sleep well, we crave for more food. The appetite centers are controlled better when we sleep. And then if you don't sleep well too, that can affect our sex drive. And there's an increased risk of heart attacks as well if we don't sleep enough. So this is a question for each and every one of us. I know that we filled survey form just now, which I'm also trying to look at to see what the responses were like. But these are some red flags that can show you that you're sleep deprived. So you need to ask yourself, do you often wake up feeling fatigued or tired? Do you yawn incessantly at work? Do you rely frequently on caffeine? Do you sleep off during the sermon or lecture or when you sit down? Or when you're not busy, you just find out, oh, I'm not busy, you just sleep off. Do you lose your thinking trail or attention span or concentration easily? Do you forget things easily? Do you experience mood swings? Do you experience feelings of stress, anger, anxiety, and frustration easily? Do you end up taking a lot of poor, risky decisions? So if that is happening, it could be that you are sleep deprived. So, okay, this picture here, I remember we were talking about lifestyle medicine, and somebody walked up to me to say, oh, please, this medicine you're talking about, please wait for me. She thought it was a pill, but lifestyle medicine is not a pill. But that's exactly what we're going to talk about now, because we want lifestyle medicine solutions, just like our the people who share their testimonies or testimonials, shared with us. So nutrition, exercise, avoidance of substances, health relationships, stress management, and a restorative sleep. These are the lifestyle medicine solutions, to enjoying a refreshing sleep. So we'll touch on them briefly, but I just need to let us know that sometimes sleep problems will persist in a person because of some predispositions. So some people have a genetic predisposition, or there's something about their personality that predisposes them to not sleeping when they should. And so it will now show up when there's a trigger, there's a factor, there's something that triggers it. Maybe they became ill, and some people, maybe when they traveled and jet lag affected their sleep, life events like the loss of a loved one, loss of a job, a traumatic experience, or environmental disruption. Those are the triggers or the precipitate factors that would come up in someone who has already been predisposed to not being able to sleep. But there are some other factors too that would now keep on perpetuating you're not able to sleep, even when the precipitating factor has been removed completely. You are well now, you're back from the travel. It's been years since you lost that job, you have another job, you have a comfortable room, but there are some other factors, and this has to do with maladaptive coping strategies like excessive time in bed, watching the clock, napping in the late evening, or worry about sleep. So those reinforced poor habits can be a problem. Fear of going to bed can be a problem. Wanting to rely on sleeping pills can be a problem. And of course, those lifestyle factors that I've talked about. So when we want to sleep, it's important to have a wind down routine within the last 1 to 2 hours before bedtime. Make sure you avoid screens, avoid watching TV, avoid scrolling, what we call mindless scrolling on your phone, because that can impair sleep quality. Even if you fall asleep, the quality of your sleep will not be the best, and then it can increase fatigue. So it's important to make your room like a cave. It should be dark, it should be cool, because your core body temperature needs to drop when you want to sleep. You should go to bed at about the same time every day, and you can engage in, relaxation techniques that will help you, to sleep. And then your diet is also important. Avoid late meals, heavy meals. So the meal should be light. It should have fiber. This is a healthy plate that is depicted here. You can see that half of the plate is veggies as much as possible. A quarter is your what do we call it now? Your healthy carbs. And then the other quarter is your protein, preferably lean protein, not something coming from an animal, but something like fish or maybe chicken. Then avoid large volumes of water before bedtime, because if you drink a lot of water at bedtime, you definitely want to wake up a number of times to pee. So it's good that you are hydrated well during the day. Make sure you drink well during the day so that you don't have to drink much at night. Then you need to be active. So there is a particular chemical that builds up your bloodstream when you are active during the day. So if you are indoors all day watching TV, just sitting down, not moving around, not exposed to natural sunlight in the morning, then you find out that sleeping at night might be a problem. So you want to be as active as possible, and you want to engage in exercise. And that was part of what our speakers testimonials, part of the testimonials that were shared, this evening. And then stress management is very important. You want to wind down at least 6 minutes before bedtime, have a cool bath, with warm water, What are your hobbies? What are the things that can distress you? You can meditate, you can spend time in nature. Studies have shown that people that spend time in nature have better sleep. You can journal your thoughts, especially at least 1 hour to 90 minutes before bedtime. Plan ahead. Don't plan at bedtime. And then try not to worry. Cast all your cares on who can, solve all those problems. And then our relationships are also very important. People hurt a lot because of poor relationships. So if we invest in our relationships, we will not hurt as much. And then we also should be kind to our loved ones. We should spend time with them. We should volunteer and learn something new. So that will help you to engage and interact with other people. Then substance use is something that should be avoided. Alcohol should be avoided because for some people have told me that, oh, I need it to fall asleep. But even if you fall asleep, you will wake up soon after, and it will make you feel groggy during the day. And because it's a diuretic, it will make you pee at night, and that will interrupt your sleep. And then something very important is toxinology. Toxinology, this has to do with our phones. Blue light exposure from our screens will suppress the sleep hormone, melatonin, delaying sleep onset. And our minds become stimulated, from social media, from playing games or work on the phone, because some of us have businesses on the phone. And of course, notifications can also disrupt and fragment the sleep cycle. So it's important for us to know that one small change can transform your sleep. You don't need to do everything at the same time, but look at, okay, let me start going to bed at about the same time every day. Turn off your phone earlier, sleep 30 minutes earlier, dim the lights before bedtime, practice deep breathing. Small habits will create a lasting change. So it's an advocacy for all of us. We can make restorative sleep a reality, by changing our mindset. There are a lot of myths about sleep. Some people, all those myths about sleeping away 1/3 of your life, let's debunk them. If you need to be evaluated because you have tried everything, you've done the sleep hygiene techniques I've shared, and it's not working, please get proper evaluation by a physician. And some people will need what we call CBT for insomnia, cognitive behavioral therapy for insomnia. You need to see your physician, and ask for this. And at the end of the day, you get restorative therapeutic sleep. So this is a testimonial by a middle-aged senior company executive who suffered sleep deprivation, having barely 2 to 4 hours of sleep for a while, and it resulted in a near-permanent headache. I was educated on the concept of restorative sleep. The culprit were lights, electronic gadgets like mobile phones, lighting, and particularly blue light spectrum. And that brought about the sleep deprivation. He says, I simply stopped fiddling with my phones and also put up my lights, and I got my sleep regime restored. So that might be the story for you. This is the story of Mr. Badebo. He has shared this with us earlier, how he was ill and he could not sleep for even 2 hours in a day despite being placed on several sedative medications, which he almost became addicted to. Of course, he went through a sleep coaching session. He made lifestyle changes, started brisk walks, changed his dietary content and timing. He avoided caffeinated drinks. And after a while, within a few weeks, he started having good sleep, which he says up to now, if he decides that he wants to sleep for 10 hours, he can sleep for 10 hours. But really, we don't want anyone to go beyond 9 hours. As much as possible, let's just stay with 9 hours a day. So I want to say a big thank you to you for listening to these tips. These are expert tips on healthy sleep, how you can enjoy your sleep. And one of the things I did during the course of the time when I was working with people who had sleep issues was to put together the Ultimate Sleep Coaching Guide, which is a 21-day guide that can change your sleep mindset and transform your sleep value. for those of us who stay till the end of this meeting, you're going to have a discount on this, on the e-copy. We'll share the link with you. So that's one of the freebies for today. So thank you so much for your attention, and I'm sure I have some questions. These are my references.
Thank you so much, Dr.
So over to you, Jai.
Thank you so much, Dr. Makinde. Amazing. I don't see anything in the chat box. Can we please give Dr. Makinde a round of applause, please, everyone? That was a thorough presentation, a lot of scientific grounding to it. And I just loved how she broke it down in her usual calm way. Yes, thank you very, very much, Dr. Makinde. I found that really helpful. I do have one or two questions, and I can see that there's one hand raised up. There's a lot of thank you, thank you, thank you, thank you, thank you. I really enjoyed listening to you there. And I'm just looking out for any questions in the audience. If there's any question, can you please identify, can you either raise your hands or can you please make a comment in the group chat? I'll try my best to pick it up, so don't rush me, please. But thank you so much, Dr. Makinde. I was really blessed by that. And again, I quite like the strategies, very simple strategies. But one thing we can say is that it does work, because we've had 3 people tell us that it works. Somebody that needed sleeping pills, somebody that just slept for 2 hours, and somebody that had looked for help from everywhere else until they started changing certain things in their habits. So we know this thing works. It's not just them say, this thing works. So I will, before I just call Kane, I can see one, there was one question somebody asked earlier about chamomile tea. What are your thoughts about using teas or things to help people to relax before they go to bed? What do you think about that, Dr. Makinde?
So using chamomile tea, yes, it has been proven, from studies to help people relax. So it can be taken, but we need to balance it out properly, because if you take, tea before bedtime, it's going to make you want to get up to use the bathroom, and that might boomerang at the end of the day. So even though, yes, it can be helpful to relax, but if you take too much of it, then you could wake up, to use the bathroom and find it difficult, to go back to sleep.
Oh, thank you for that. Again, it's about limiting your fluid, not necessarily limiting your fluid intake through the day, but at night time, just to make sure you can have a good stretch of sleep. So if you're going to drink it, maybe drink it earlier in the day. What about the caffeine content? I think caffeine, a lot of these teas have some caffeine content, which can also affect the quality of sleep, don't they? So it's very important to look out for that.
Yes. So you don't want to take caffeine containing teas after, well, some people will say 12 noon, some people will say 3 o'clock. I think you should just take any caffeine you want to take at all. Take it before, 12 in the morning, and not throughout the day.
I agree. So I'm going to call, please, my apologies. I'm not sure if that's Dr. Kane or Mr. Kane. Please, my apologies. Mr. Kane, can I get you to unmute yourself and then ask your question, please?
Thank you, Jai.
Okay, it's a lady.
Yes, yes, thank
I'm
you.
sorry.
It's fine. So thank you so much, Dr. Makinde. It's been a while. I got on this platform. It's surprising that it's 6 years. I'll say we started this because I kind of part of it. So thank you for sustaining it. So just I think personally for me, of all the lifestyle pillars, I think sleep for me is one I really relate with and I do quite well. It was surprising that I saw in one of your categories, and please correct me if I'm not quite right, but there's also fear of not sleeping, right? That's one. And then I saw somewhere, I think you skipped explaining it, where you indicated reverse scrolling. Can you please throw more light on that, Dr. Mackindy?
Okay, that was revenge scrolling.
Revenge, yes, revenge
Yes,
scrolling. Yes.
just scrolling with the revenge, as in, sometimes my children, when they come back home and I see them on TikTok, Instagram, in fact, yeah, it's like you have not even finished watching one thing, and before you know it, I'm like, how do you even cope with this? You're on one thing, you have moved to the next thing, so you're just scrolling. I think that's what revenge scrolling means. So because I talked a lot about screen time, that's why I didn't go, into that as well. But it's one of the things that can also um, cause screen addiction. The fact that you
Okay.
just want to see what everybody is doing, look at
Okay.
people's status, see stories. So that was what I meant there.
Okay. Okay. Clear. And then for fear of not sleeping, how would you really explain that? Because I think personally, maybe I have that.
Okay, so the fear of not sleeping, I would want to find out, have you had a traumatic experience that is associated with sleep?
No.
Or
So mine is that I sleep, I consider it that I sleep quite early, right? So I get a bit agitated if it's my bedtime and something prevents me from sleeping because I love to sleep, right? So if anything is going to keep me awake, I also fear that I may not sleep enough and then I have to wake up because I have to go to work early. So I
okay.
don't know, maybe it's something I haven't really thought about it in relation to what you are saying. So it appears it's quite different from what you mentioned.
So that is also something that can reinforce insomnia. So if one is having insomnia, some negative thoughts could come in as a result, and one will have some thoughts, some extreme thoughts like, oh, if I don't sleep enough, I might not be able to perform at work tomorrow. Oh, I might have a problem with my boss. So it can further reinforce problems with sleep. So it's very important to be calm and to be trusting and to be positive, to say that even for people who are sleeping 6 hours now, or they're sleeping 4 hours because they have problems sleeping, they need to have a positive mindset to say that, well, I'm thankful that I can even sleep 4 hours right now, but I'm going to practice all these strategies and I know my sleep will become better. Even if I'm sleeping for just 4 hours, I will ensure that my 4 hours are deep and I don't have anything to worry about. I'll be fine. It's better to have a positive mindset and expectation than to think that, oh, if I don't sleep these 8 hours, I might get into trouble and I might um, um, run into another car on the road. So we don't want negative thoughts, to come up as a result of one wanting to get all those hours. Otherwise, they can reinforce their anxiety and insomnia. I don't know whether that makes sense.
Very true. Yeah, very true. Yes. So I mean, mine is not that extreme. So I actually sleep well. So even though I have that mild fear, but I actually sleep well. So thank you again for this session.
Thank
Yeah,
you very
Harry.
much for that lovely interaction there, Kane. That was beautiful.
I
And
have
that's
one
the
more thing to say. Sorry.
okay, go ahead.
I'm sorry. Yes. So again, there's a concept around white noise. Can you please talk to us about it?
Okay. So white noise has to do with a combination of frequencies, that can mask the environmental noise. So, and it's especially recommended for shift workers, people who have to sleep during the day. But it can also be used at night.
Hello.
Okay. Usually emanating from an app or even a fan, or just for some people it could be the sound of the AC, the sound of something in the background, just making them feel a bit calmer. So the air frequency that picks it up, is it is a bit lower than all the other frequencies around. So it can mask those frequencies, especially during the day, maybe a dog barking, a child crying, so it's actually recommended a lot for shift workers. So it's been shown, studies have shown that it can actually help, with sleep for people who have some difficulty initiating sleep or maintaining sleep. There are apps for that actually. If you go to YouTube, white noise apps.
Thank you very much. I hope that's answered all your questions. I think that's the advantage of these webinars. You get some of your own questions answered. Obviously, that doesn't take the place of seeking help from a qualified medical professional as well. If you're having some of these issues, it's always really important. But these questions really, we all learn from it because most of us have these questions in our hearts. So when somebody asks it, we're answering the questions for many other people who are probably not asking it. So thank you very much for that. I have about maybe 3 more questions, if that's okay. Do we still have enough time, Dr. Makinde? You're muted. Okay, you're muted, but I'll keep going so that we would.
So sorry, I didn't realize I was muted. I said we have about 13 minutes to go.
13 more minutes, so we really need to use it, okay? I have 3 more questions, but please stay to the very end, everyone, because I think we might be sharing the results of our survey, maybe now or later, but we would also have some bonus points. Please wait for this, okay? Please don't sign off until you get it. May I give a shout out to everyone who's joined us from the beginning, and for you all for waiting. So I'm really, really grateful for that as well. Now, one of the questions we have here is, I'm waking up at night due to night sweats. How can I deal with this? I want to assume it's a perimenopausal or menopausal woman asking that question. You're muted.
Okay, thank you very much. So yes, I guess it's someone in the perimenopause asking that question. And I know many of us, including myself, have had some of these concerns, about hot flashes, night sweats, so our body needs a certain temperature, to be able to fall asleep at night. So it's important that we also condition our bodies, especially if we have gotten to that stage of menopause and you know that, okay, you are likely to have that problem at night. So first of all, avoid spicy foods, avoid very hot meals, avoid things that get your emotion triggered, because there is usually a connect between, anxious emotions and triggers, of those night sweats or the hot flashes. And so you can have a warm bath before bedtime. A warm bath will help. You make sure the room temperatures are very cool, and make sure that your feet are outside your blanket. So don't cover your feet because we lose heat from our feet. So if your feet have been covered for a while, so at the end of the day, the core body temperature will go up and that will wake you up. So just little strategies, that one could also do that can mitigate the effects. But I know that Dr. Jaye too has an interest in women, so maybe she can also share, from her own experience, some of the things that would help as well.
covered all the points. Again, I think diet is really important. You already mentioned avoiding spices. One of the things I always tell women is when you eat at night matters as well. If you're eating late night meals, especially people who are on some kind of high protein diet, especially, there's a lot of diets all around flying everywhere, and you eat a meal with a lot of meat inside, or you know how we like a lot of carbohydrates before bedtime. Some people eat very large bowls of pounded yam or something like that. You will find that your body is releasing a lot of sugar into there's a lot of insulin released. The high insulin levels can affect your release of melatonin, and all of that can affect how you sleep at night. So try to have your meals early, heavier meals earlier in the day and lighter meals in the evening. But Dr. Makinde has covered it all. Thank you very much for that thorough answer. I'm going to move because we don't have a lot of time left. As I can see, Dupe's hand was actually raised earlier on. Dupe, can you come on? But before Dupe comes on, I just want you to begin to write one thing that you're going to take away from tonight. Please write it in the chat. One thing you're going to hold yourself accountable for starting from tonight, from what Dr. Makinde had shared with us earlier on. So Dupe, please come on, please, to ask your question. Dupe, please unmute yourself.
I don't know. Good evening.
Good evening.
Okay, it's Modupe. So when you said Dupe, I thought it's another person there. Good evening, everyone. Good evening, Dr. Makinde. This is my first time here, and I thank God for the network did not allow me to hear all the testimonies. But from what I've heard, I thank God for that. And I put a question in the chat, and that was the question was, is it compulsory that we have 9 hours straight sleep? I drink a lot of water before. We were told that we should drink water so that you don't have heart attack or something like that. So also many things we keep on hearing. So, and for you to have, I go to toilet maybe 2 times because my bottle of water is, and every time I go to the toilet, I drink again because I know that your blood is the water and the oxygen. The little I know that you need water for the oxygen to work in your blood or whatever. So I want to ask: is it possible for us to have 9 hours straight, or we can break it maybe for your 9 hours to be completed? You sleep for maybe you have a nap in the afternoon, 2 hours. Then in the evening, maybe you do 7 or 6 hours so that you have your 9 hours. Thank you.
Thank you for your question, Ma, and we're really glad to have you join us today. So sleep, when we talk about sleep, we're talking about the quality of that sleep. We're talking about the continuity, and we're talking about the duration. So yes, we talk about the duration, 7 to 9 hours. How continuous your sleep is also important because we have cycles. We go in and out, of sleep cycles. And so if that sleep cycle is interrupted, then you're going to be missing out something. So yes, you might not be able to get all the hours at once, but you want to get at least 6 to 7 hours at most at once. The person that shared with us today said he can do 9 hours. So if you can do it straight up, why not? Except you're having difficulty because of the kind of work you're doing. But if it is because you are drinking water, you actually should not get up to use the bathroom more than once at night, except you are pregnant, or maybe the person has maybe a prostatic disease. So if you are not well hydrated during the day, you feel a need to keep on drinking at night. So you need to be well hydrated, drink enough water during the day. At night, you will limit fluids. When you limit fluids, you don't have to get up to go to the bathroom. If at all you get up, it shouldn't be more than once. So once your sleep is interrupted, up to 2-3 times, it's going to affect the quality of your sleep. So the only way to mitigate that is to ensure that you reduce fluids, before bedtime. At the same time, you can also keep a bottle of water. I always have a bottle of water beside me at night, because if you wake up thirsty and you decide to get up and you open the fridge, you drink the water, you are going to stimulate alertness. All the lights, the white light from the fridge, they're going to go in there and send signals to your brain and switch off your melatonin. And so you're going to lie down on that bed for another 1 hour or more, trying to find sleep. So that's the way to balance it. And then studies have shown that if you can get fiber into your nighttime meal, which shouldn't be taken too late, it can reduce the number of times in which you wake up. So you don't have to wake up frequently. You can actually decide, I don't want to wake up at all to use the bathroom. And that will be predetermined by your meal time, how much water or fluid you take. I hope that answers your question, Ma.
Thank you very much for that. We don't have a lot of time for too many questions. We have 2 quick questions I'm going to join together. And then I think the final question will be from Dr. Cordin. Thank you very much, everyone. Please stay. There's a bonus we want to share with you before we finish. And I'm very grateful for as many of you that are writing one thing you're going to take away. I want to give a very quick shout. Everybody's here is important, but there are some people who are important and special that we have to acknowledge. So I just want to acknowledge my husband, Professor Laleye. Thank you for joining us. I really appreciate your efforts. Thank you so much. So I'm going to take 2 questions together now. How many months should we try conservative method before going for sleep studies? And also, night shift workers. Dr. Makinde, how are we going to sort this problem out? So I don't like the idea of that carcinogens that you talked to. So please, can you touch on those 2 questions? And then we'll take our final question from Dr. Cordin. Thank you very much, everyone, for your participation.
Okay, thank you for that question. Once you are not sleeping, please see your physician. Once you know you're not sleeping, even for the people that share testimonials, they had to see their physician, maybe preferably a sleep coach, a sleep physician, or a lifestyle medicine physician, because of course they had talked about how they had gone to several hospitals, several doctors, and they had been given pills, and that didn't solve the problem. So you want to see someone who really knows the science behind your not sleeping. So, but like I said, there are several disorders. So we need to get to the root cause of why you're not sleeping. So once you know you're not sleeping, don't wait for several months before, showing up with the doctor. And one of the things that you will get from being here tonight is you'll get a discounted sleep consultation. So if there's someone here tonight who would like to have a consultation, with the lifestyle medicine physician, you could let us know. You're going to have a discount on that. So that's one of the freebies. We like call it a freebie, or one of these, for tonight.
Please, I'm going to ask you to please offer that to the women in my community as well, please. Okay, second question, please.
That one has to do with night shift work. Yes, I don't know how many people are doing night shift work here. Are we many? I know that as a resident doctor, I had to do a lot of night shift work. I don't do night shift work now anymore. And for people who are even consultants, people who are surgeons and all that, or people who have to still work at night, there should be a way to balance it. It shouldn't be every night that you're getting up, to take care of patients. There should be a roster, and there should be at least 11 hours given, for you to be able to recover from your shift work. So we don't expect that people will do shift work and then go back to work in the morning without recovering properly. And then the other thing is that people that do night shift work, what do they do when they get home? Some people will not go back to sleep. They will go for another job. They will start doing house chores. So it's about prioritizing sleep, even when we are doing that shift work, to know that, as I'm going back home right now, I'm going to sleep. I think that's the much I can say about it.
Thank you very much. Okay, please indulge us a few more minutes and we would round up shortly. Dr. Corden, thank you so much for being patient. Can you please ask your question? Please unmute yourself.
Okay, Suzanne.
There you go.
Okay.
It's finally working. Can you hear me?
Yes.
Yeah.
Yes, we
Thanks a
can.
lot, Ori, for the really interesting talk, and sorry for the bit I missed in the middle. My network kicked me out. I actually just wanted to ask, is there at all any discussion in Nigeria and other African countries about people with neurodivergencies and the sleep issues that they have? Because I'm sorry to say that I'm discovering through a diagnosis that I've had on myself. I found out less than 2 years ago now that I have ADHD myself, and a couple of my sleep issues are actually directly linked to that. And I had no idea that the two sort of meet somewhere in the middle. So I was sort of wondering, is that an issue that has cropped up a lot in African countries, as in specifically Nigeria, because that's where you guys are based? But I'm sort of wondering how much is that something that comes up with the patients?
Okay, so I guess talking about ADHD in adults, well, I've not encountered that, or there are other problems that people might have as a result of anxiety, depression. Those are most of the encounters I've had, in terms of patients presenting with poor sleep or insomnia. But I can't say that I've really encountered anyone with that particular diagnosis. So, but I know it's something that could be a problem, anywhere in the world. So what has helped you? What has helped you as a person to overcome?
Ironically, the funny thing that helped is understanding that the same rules don't apply automatically for somebody who has that kind of problem. As in, I obviously still need to have the same amount of sleep like other normal people do, etc. But things like trying to force somebody who has ADHD to, for example, stop using a screen late at night before going to bed can sometimes be counterproductive. So I've tried to switch it. Instead of using my phone, say late at night or whatever, I'll cheat and I'll read a little bit, but I try and put a limit on it. I'll say no more than one chapter, and then I have to, lights out. Because my brain works on overtime anyway. The problems also have repercussions on the next day. Waking up in the morning is really hard because of the way my sleep cycles function. So there's a couple sleep specialists actually who've suggested things like taking medication. If you use medication, to take the medication for your focus about half an hour before you actually plan on actually getting out of bed, to enable to sort of slide into your day and therefore find it less of a struggle getting up. There's a weird little things that have maybe made a difference. And the thing is, when you speak about people coming and speaking about anxiety or thoughts that don't stop, etc., to maybe keep in the back of your mind that maybe there's something else going on than just more of a psychiatric issue like depression or those kind of things. Sometimes it can hide something completely different behind it, because as soon as I found out what's wrong, well, it changed everything, because I've been to a psychiatrist because I did at some point have issues with going more in the direction of a depression, but I found out that it's actually all linked. So
Yeah.
I always say keep an open mind and ask people sort of maybe a bit more than what you planned on asking to begin with.
Yeah, Dr. Makinde, I just want to say something based off of what she said. Can I just say something?
Please go ahead. Please go ahead.
Yeah. So thank you very much, Dr. Corden. I hope I got the name. The first question you asked, I think that ADHD is underdiagnosed in our environment. If we For adults, basically, it's really grossly underdiagnosed. So thank you for sharing your experience. And I also just relate because I know someone typically who has sleep issues and also has ADHD. So before you spoke, I didn't really relate the two directly, but as you spoke, it's just classical that all the symptoms you've talked about, the thoughts in the head, the prolonged screen time, and then the anxiety related symptoms and poor sleep are really classical for the person. So I'd really like to connect with you to know more about how you feel, and so I can also help the person. Thank you so much.
Ori has my details.
Yes, I'll get from her. Thank you.
That's
Amazing.
really amazing. That's really amazing.
Amazing stuff. I was
We
just going
are
to
all learning.
share my little experience from that as well. I work in a different country. I work here in the UK where we have a lot of adults, more and more, we're having a lot of adults being diagnosed with ADHD. And I want to share Dr. Keynes. I'm sorry, if that's Mrs. Keynes, experience for sharing your experience in Nigeria as well. And it's grossly underdiagnosed in Nigeria. And almost every day I see women who have finally realized at an earlier age that you know, light bulb moments. Oh, this is my issue. This is why I've always struggled since childhood. And finally I get to understand myself. We definitely know that there's an impact on melatonin with ADHD and the way the body processes your circadian rhythm as well with ADHD. So certainly it affects the sleep rhythms. But a number of the strategies Dr. Makinde shared tonight might still be helpful. Obviously, it's really important that we take this as a personalized medicine. What we share here is actually quite generalized, and you may find that one or two strategies may not really work for you, but there might be another thing that works for you. And the idea really is that your body is not producing melatonin as it should, or is not releasing melatonin at the right time for like everybody else, and it's a bit delayed. So you may find that, oh yes, you can use your screens to a certain time, but always the recommendation is to avoid it at least an hour before bed. It might be difficult to have a set time to sleep and set time to wake up, partly because of the way you are wired. And I say people who have ADHD are just wired differently. And you just have to understand that it's just your wiring and you can't compare yourself to everybody else. So you might have your own set time, might be 1 o'clock in the morning, as long as you can get your 6 hours of sleep, or 7 hours or 9 hours and wake up at 10. If that works for you, great. But a number of strategies like the dietary strategies, the managing the stress strategies are all still very relevant, even in that environment. But yeah, it's always good to find out a bit more about people. When people say they are anxious or depressed, there might be a story behind it if you take your time to listen very carefully. I think we have to stop now. I'm thanking you for your participation.
Recommend Ori's book, her sleep book. For those of you who haven't already looked at it or gotten it, she wrote a book with a lot of really, really good suggestions and things. And that's also stuff that people can implement. I've shared that with other people, depending on, whoever it was appropriate for. So I always say, give it a shot.
Thank you very much. All right. Do we have Mrs. Kolade who wants to share the bonus? Come on.
Okay. So, so there are a few things. So there are actually 3 things. Let me say thank you once again for everyone. I'm just so grateful for this conversation, and thank you so much to Professor Olaleye, who is the head of our own class of 2002 Pouch 98 is here. He's here to support his wife as well as me. Thank you so much for being here.
I'm here to support you both too. Thank
Yes,
you
let's
so
hear your
much.
voice. Let's hear your voice for some minutes, please.
Oh, thank you. Thank you so much, Dr. Makinde, for the excellent talk on improving our sleep. We're really, really grateful for how you pour out into this community and how you lead well. Jaya, thank you so much for moderating so well and for the kind welcome. Yes, it's a pleasure to be part of the College of Medicine Ibadan. Class of 2002, and these two heroines are part of our class, so we're really proud of them, and that's why a lot of us are here. Dr. Femi Ibrahim, Dr. Bumi Abodunde, and everybody from the College of Medicine, Dr. Adegboyega, and obviously thank you to the Makinde twins, my bonds, who are here supporting Drs. Taiwo and Dr. Kehinde Makinde and Ore Kolade. Thank you so much for everything that you do, and it's a pleasure to learn from you both. God bless.
Thank you so much. Thank you. And I can see many of our other classmates on the call. A big shout out to Pouch 98. So let me just quickly tell us the what the feedback is from, just before we go, the form that we filled. I just want to tell us what we found. Sorry, give me a minute. Let me bring that up. Yes. So as I'm trying to bring that up, if you're interested in a discounted consultation with a lifestyle medicine physician, please could you just drop your email in the chat box? Drop your email in the chat box, please. So we'll reach out to you. That's for the consultation. So for the responses, we have 33 responses on the call, 3 on the Google form. So let's see. Let me give us a summary. So it's interesting that we have a wide group of people here, the age range. Most of the people here are between 40 to 49, that's 39.4%. Then people under age 20, oh, sorry, nobody under age 20. People who are over 60, we have 21.2% over 60. We have 21.2 who are between 50 and 59. And then we have 18.2% who are between 30 and 39. Then we have more females than males. About 66.7% are females, and then 33.3 are male. And let me not talk about the occupation, but we have students, we have healthcare workers, business professionals, civil servants, entrepreneurs here. So on the average, so there was a question that said, on average, how many hours do you sleep at night? So only 6.1% said more than 8 hours. 20.6% said 7 to 8 hours. And then most people, 58.8% said between 5 and 6 hours. Then 14.7% said less than 5 hours. So that shows that most people here are not getting adequate sleep. Most people are getting less than 7 hours. Okay. What time do you usually go to bed? Most people go to bed around 11 to 12 a.m. Yes, 11 p.m. to 12 midnight. That's 61.8%. And very few go to bed before 9 p.m. Most people, some people go after midnight, about 8.8% go after midnight. So how would you rate your sleep quality? 50% rate it as good, 41.2% as fair, then 5.9% as poor. So those people who rate their sleep quality as poor, please I guess you'll be the ones putting your emails in the chat box. If you rate your sleep quality as good, you don't need a sleep consultation. How often do you wake up during the night? 79.4% say occasionally, and then 20.8% say frequently. How often do you feel tired and sleepy during the day? We have a lot of people saying sometimes. 88.3%. Some say often, some say almost every day. And then we have quite a number of people saying they have difficulty falling asleep. About 61.8% say occasionally, then 8.8% say often, and 29.4% say never. So do you use your phone or electronic devices within 30 minutes before you sleep? So we have a lot of people saying sometimes, 32.4%, 38.2% saying often. So we have a lot of people who go on their devices. So that might be something that would be the game changer for some of us if we're able to go off our screens well before bedtime. Do you often nap during the day? Occasionally, frequently? So we have more people saying occasionally, 70.6%. Do you have a regular bedtime routine? Most people say no. So I think that's going to be something that will help us. Have you ever sought help for a sleep problem? Most people say no. Would you be interested in learning more about improving sleep? 1.2% say yes. So let me stop there. So please, I want to believe that you have put your email in the chat box for those who want access to that consultation. We need to wrap it up now. And then something I'm going to send to us as well is a tracker, what we call a sleep tracker. So we want you to track your sleep in the next how many days now? In the next 30 days. So that's what I'm trying to send right now. So please download it and use it to track your sleep within the next 30 days. See how well you're doing, especially with some of the things that we have talked about tonight. And then the last thing is, please, if you want to have a code, if you want to get the code to you want to get a code to be able to download a free copy of the sleep book, please click on this link that I'm also going to share, because that's where the code will be shared. Yeah, so sorry, just trying to. No time is fast spent. Okay. So please, if you want a copy of that book, please click on this link. So that's where it's going to be shared. And then the last thing is the file that will help you to track your sleep. All right. So I hope we have seen that those two things I've shared. Okay, I'll put the sleep tracker in the WhatsApp group as well. Yes. All right. So back to you, Jai. I think I'm done.
Okay, that's great. Thank you again, everyone, for staying still to the very end. We really appreciate all your conversations, the interaction, the community. We're really grateful for your attention as well. It's not easy sitting for webinars, and paying attention is really one of the biggest prizes that we can give somebody else, and we don't take this for granted. We really appreciate this, and we pray that God will continue to guide us all, give us good sleep. And also, if there are challenges that we are facing going to sleep, that He will always give His beloved good sleep. So thank you all very much. And Dr. Makinde, did you want anybody else to give a vote of thanks or prayers or anything along those lines at all?
Yes, let me invite my twin sister to do that for us.
Okay.
All right.
All right. Thank you, Jai. Thank you, Ori. Special thanks to Jai for anchoring the session, for moderating, and to Ori too for yes, you brought it again this time. Thank you so much for your words of wisdom. And thank you everyone for being here, for staying till the end. For those of you also who joined earlier and left, thank you also in absentia. We really appreciate your presence. Good to see you all. So I'm wishing you a lovely night rest. And we hope to see you next time. God bless you.
Yes, thank you so much, everyone.